Well, Dr. Mallika, Sandy writes, I am a 69-year-old grandmother and am fully vaccinated. My daughter has asked me if I could stay with my 14-year-old grandson for a week while she travels for work. What risks are there staying with my grandson?
Well, now that you are fully vaccinated, congratulations, you're at much, much lower risk of getting severe complications from COVID-19. The problem is we still don't know for sure whether people who are vaccinated can catch the virus, not develop symptoms, and unwittingly pass the virus on to others. But if your grandson is at low risk for COVID-19 complications, it probably is okay. You can check the CDC guidelines.
Teresa writes, my daughter, who has a baby but wants more children, is afraid to get vaccinated because she heard the vaccine could make her infertile. Is that true?
This is a complete and total myth that keeps getting passed on, and I'm really sad to hear it. There is no evidence that any of these vaccines can adversely affect anyone's infertility, and there's mounting evidence that it actually is safe in pregnant women and for nursing moms. So please encourage your daughter to get vaccinated.
Well, Cindy writes, there's a debate regarding the eligibility of people in Massachusetts in the current phase. Some people think retail includes anyone who works for a small business. Others think it only refers to people working in the food industry. Could you clarify?
I wish I could, and I actually took a very careful look at the language, and I'm not completely sure. However, I would expect that anyone who works in retail, who has any contact with customers, direct contact, whether it's in a food-related industry or not, would be eligible at this time.
Well, Judy writes on Facebook, is it okay to get the COVID vaccine if I take Miralax every day? I heard that both have the same ingredient.
Yes, you can take Miralax and get vaccinated against COVID-19. The concern is for people who are allergic to an active ingredient in Miralax called polyethylene glycol, which is used in the two mRNA vaccines, the Pfizer vaccine and the Moderna vaccine. People who have an allergy to polyethylene glycol probably cannot get one of those two mRNA vaccines, but they could get the Johnson & Johnson vaccine.
Interesting. And Carol asks on Facebook, how can you say the vaccines are safe, especially when no one knows what the long-term effects will be? I will not get this vaccine, along with many others, because it has not been proven safe long-term.
You know, this is a concern for a lot of people out there, but honestly, if you're going to get an adverse reaction to a vaccine, it usually occurs in the first 2 months. It is unlikely that there are going to be any serious long-term complications from any of these vaccines, so please reconsider getting vaccinated.
And I thought it was good news that the CDC director today said that the vaccine appears to be working very well, right?
That's right. Very encouraging news.
Good news. All right, Dr. Mallika, thanks so much. And Dr. Mallika offers her best advice. But as always, we remind you, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, here are the 3 ways to reach her. Her email, drmallika@cbs.com, on Twitter, @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.